Meanwhile, eligible South Africans can now get a COVID-19 booster shot. The Health Department has approved a Johnson & Johnson booster. The rollout started today, and the department says single-dose J&J boosters should be administered at least 2 months after the first vaccination. Well, let's get some details about all of this with the Deputy DG of the Health Department, Dr. Nicholas Crisp. Dr. Crisp, good afternoon. Thank you very much for your time. Well, today is the start of the J&J booster shot for everybody else. And from what you know, how has it been going so far?
Yeah, good afternoon and hi to the listeners. Merry Christmas to everybody who's watching. So we've had a couple of questions this morning of people in particular who were participants of the Sisonke 1 study who did not get vaccinated as part of Sisonke 2. But other than that, it seems to have gone smoothly. We know that not a lot of vaccination sites are open at the moment, and we know that not all sites have Johnson & Johnson vaccine. But otherwise, we've not heard of a lot of complaints during the course of today.
Okay, can you use this opportunity to clarify what will be the difference between Sisonke 1 and Sisonke 2 and how that gets affected by the booster shot?
Sure. Yeah, no, thanks very much. So we have 2 very good vaccines that we use in South Africa. We're happy with both of them. The Johnson & Johnson vaccine was the one that we used first, and we used it for vaccinating healthcare workers before the National Health Rollout Program, and that was between the 17th of February and the 16th of May of this year. And those people were part of a study called the Sisonke 1 study, or the Sisonke study. Recently, we have offered booster doses of Johnson & Johnson to those people as part of accumulating data that has now been used to verify the safety and the efficacy of this vaccine for the rollout to the general population. That was the Sisonke 2 study, which ended on the 17th of December, just the other day. Now, the data that came in from that study, plus study information that came from across the world, was submitted to the regulator, SAHPRA, by Johnson & Johnson, and has been approved. The use of this Johnson & Johnson for booster doses was approved during the course of this week, which gave us the go-ahead now to open up for vaccination of the general population, offering a Johnson & Johnson booster dose. It's the same vaccine that gets given 60 days after the first vaccination or longer, anything from 2 to 6 months. So that is the boost. For those who got Pfizer vaccine,
Dr. Chris,
Pfizer vaccine has already been registered for boost.
Yeah, Dr. Chris, sorry, before we get to Pfizer, just to follow through on the Johnson & Johnson, that you're coming in. So if you got the J&J Sisonke as part of the study 1 as a healthcare worker, by now you should have received the booster. Am I correct?
Yes, but not everybody did. Somewhere around 250,000 or thereabouts people came forward for their boosters, which means there's still quite a lot of healthcare workers. The original number of doses given in the Sisonke 1 was 480,000, roundabout. So there's still quite a few healthcare workers who have not got Johnson & Johnson booster doses. They can get them now as part of the national program.
And they don't have to wait any longer period. They are now eligible immediately, of course.
Yes, anybody who's got a Johnson & Johnson vaccine at least 60 days ago is eligible now.
Okay, thank you. Now, let's move on to Pfizer, okay? I just wanted to clarify that. I'm one of the general population. I got my Pfizer double doses, one in one in June, and then one in July. I have to wait for 6 months. I'm sorry if I'm using myself as an example. 6 months is next month, which is January. So until next month, I cannot get my booster Pfizer.
Yeah, that's correct. So, again, the regulator approved the use of this vaccine 6 months after the second of the 2 primary doses. And for those who were the very first to get Pfizer vaccine, their date comes up on the 28th of December, which is 42 days after the first dose for those who were on time for their second dose. So there are a few people who will qualify. Mostly those are people over the age of 60, because those were the first age groups that we used the Pfizer vaccine to vaccinate. So from then onwards, people, once they reach the 6-month period, will be able to come forward and get a booster dose.
Okay, just a technical clarification that is on my head now as you've been answering. We were told that the J&J, originally when the whole process started for vaccines, is that you only needed 1 dose of J&J, but Pfizer, you needed 2 doses, okay? But now we are all getting boosters. So if you're Pfizer, vaccinated by Pfizer, the upcoming booster will be your 3rd dose. But if you're J&J, the upcoming booster will be your 2nd dose of vaccine. Am I correct?
Yes, that's how the schedule is at the moment. We learn a lot as we go along. Remember, we've never had COVID before, and we've never had these vaccines before. So we have learned that over a period of time, the immune response in our bodies does decrease, and that by giving this dose, this additional dose after some time, our bodies boost our immunity. And that is round about these periods, sometime after 2 months for the Johnson & Johnson vaccine, seems to be the best time to boost. And because you're getting 2 doses of the Pfizer, it seems to last a bit longer, and you get your booster dose at 6 months.
And currently, you as the health scientists and health professionals, you are satisfied that South Africa, we've got 2 of the best vaccines, as in J&J, as in Pfizer.
Well, I think we can be very happy that what we have bought and used in the country is definitely showing that they work. We are seeing very, very little, if any, serious disease from people who have been vaccinated. We watch the people who are being admitted in the hospitals, and despite this massive peak that we have had now during this Omicron variant, we've been pleased that very, very few people who have been vaccinated have ended up in hospital, and most of those are people who haven't been fully vaccinated or have other serious conditions. So there's definitely protection from these vaccines, and we're happy that we are using them.